On this channel, I try to help PAs and NPs think about all the different possibilities they have open to them. But we're going to talk about a possibility today, an area of medicine that I am willing to bet most PAs and NPs would say that we're not allowed to work in, that PAs and NPs don't work in this specialty. What are we talking about today? Well, we're going to talk about ophthalmology. Yes, PAs and NPs can absolutely work in ophthalmology in clinics and also doing ophthalmology surgery. Today, I'm going to be joined by a PA who has kind of forged his own way, and he is going to tell us about his journey in ophthalmology, what it's like to work in this specialty, what kind of things you'll do as a PA or an NP, kind of surgeries you can be involved in, what the great schedule and pay could be like for you in this specialty. And he's also going to tell us towards the end of the video what resources are available for those who are coming behind him who are interested in the same path. If that's interesting to you, or if you just wanted to find out what the heck a PA or NP does in ophthalmology, then stay tuned. Hi, it's Michelle with the Medicine Couch. Thank you so much for joining me. And as always, if you haven't subscribed, please do hit that little button down below, hit the notification bell so you know when I release a video every week. Now let's hear what Joel has to say about ophthalmology.
Good day, everyone. My name is Joel Silik, and I am an ophthalmology physician assistant. I graduated from PA school in 2019, and I'm looking forward to sharing you about the day in life of a PA in ophthalmology.
Thank you so much, Joel, for joining us today.
Absolutely. Thank you for having me.
So ophthalmology, I'm sure you get people giving you this weird look all the time when you say you're an ophthalmology PA, because it is not normal, not what we are used to as a specialty that PAs and NPs, I presume, can work in. Have you always worked in ophthalmology? Like since you graduated from PA school, has it been 100% ophthalmology?
No, since I graduated from PA school, because it wasn't commonplace, I landed in family medicine. And I did that for almost a year. And then I finally was able to find an opportunity in ophthalmology. And I've been there now for the last couple of years.
Why ophthalmology? And was it something you were interested in before PA school, or is it something just that you discovered along the way on your schooling route?
Ophthalmology was how I got my patient care experience before PA school. So then I entered PA school knowing I wanted to do ophthalmology, but that it wasn't common. But I quickly found it was just the specialty for me. And I can go on and on all day, but I think the main core reason is just we communicate with our eyes. And so I find them to be very inviting, very beautiful, and just very unique. And across all cultures, languages, it's a moment shared between humanity of just eye contact. Ophthalmology was just that blend for me where I could see the science of medicine, but also the artistry of it. And it was a moment of just human connection. And I can't believe I get to gaze into people's eyes for a living. So that's pretty much the true reason, to be honest. I love it. I'm obsessed.
Before PA school, did you know that PAs and NPs worked in it? Like, did the ophthalmologist you worked for, did he help you with that? Or how did you know that it was even something we could do?
I knew I wanted to be a PA before I wanted to do ophthalmology. And so when I started in ophthalmology and I was working with optometrists and ophthalmologists, I had this internal dichotomy of like, well, I wanted to be a PA, but I'm not seeing this as a possibility. But in working alongside those providers, I knew I didn't want to do optometry school, and I knew I still didn't want to do medical school. And so I was like, I'm just going to stay true to that natural instinct, which is I'm going to go to PA school. And I basically told myself, I'm going to figure it out. Even though it's not an option out there, I'm just going to do it. And so I didn't know if it was possible, but I also knew that that's where my passion lied. And that to me was worth giving a try for, even if I was told no. I knew eventually someone would say yes. I think passions demand relationships. They draw people together. And when you find someone who's equally passionate about your specialty, then you just kind of are magnetically drawn and you figure it out. And I finally just cold called hundreds of clinics and was told no and no and no. And then I finally found someone who was, I get it, I see this, and they gave it a try, and here we are.
Obviously, you didn't have any rotations in ophthalmology as a PA, or did you? Did you like arrange any kind of special rotation?
I did. So if anyone's out there that's really interested in ophthalmology, whether they're like me and had the experience beforehand, or they're just kind of intrigued by the idea, I highly recommend doing rotations in PA school. I created my own 2 elective rotations. My program gave me 2 electives. And I made them myself. You're going to find this out there. If this is your situation, your program is going to do what they did to me and said, we don't have any ophthalmology contacts. So my first rotation, I went to my home clinic. That was easy. I knew them, they knew me, and I made it very clear when I went in there that these are my goals of the rotation. I'm not here to function like a technician again. I'm here as a PA student. This is what I want out of this. Can you do that? And they said yes. And then I applied to Duke University's PA program. That wasn't my home program, but I went and got accepted into the program as what they call a visiting student. And their program only gives out visiting students certain specialties because they don't want you competing with their own students, understandably so. Unfortunately for me, ophthalmology, no one's looking for. And so they approved me, and I went in and I went to Duke and did a rotation there and a lot of the subspecialties within ophthalmology. And so I came out of PA school with 2 rotations under my belt, which really helped my onboarding when I became an actual ophthalmology PA for sure.
Yeah.
So definitely do rotations if you can, but the work's going to be on you to figure it out.
Well, normally I ask this question later in the interview, but since we're talking about rotations, I imagine if you're going through your regular rotations with the eye, no pun intended, with the eye of looking at ophthalmology, what other rotations did you feel like you had, or did you have any ophthalmology related experiences in other rotations?
Yeah, I love this question because when I'm often teaching ophthalmology to PA students, whether in their didactic year or clinical year, a lot of them feel it's not applicable. Oh, I'm not doing ophthalmology. And it's like, you're going to see it elsewhere. So I found it in family medicine, primary care, urgent care, emergency medicine. The emergency medicine physicians, they gave me all the eye ones because they were like, you actually know how to use this lamp. I have no idea. It was really fun to be able to do eye care in a eye care setting. I've only ever had access to everything I needed. And so it was good for me to learn how to do an eye exam and just utilize the limited resources and other specialties.
Yeah, I mean, we all, especially if you work family practice, urgent care, emergency medicine, you get the red eye, you get the blood in the eye, you get, people get hit in the eye.
I mean, I remember being a family medicine PA student, and it said set in blurry vision, and my preceptor was like, you can have it. And I went and I saw her, and we're in a primary care's office. I have no imaging, nothing that we do in an eye clinic, and I'm doing what I could, and I'm like, I think she needs a visual field. And I sent her to ophthalmology, and she had glioblastoma.
Oh, wow.
Aggressive form of brain cancer. And her first symptoms was, my peripheral vision seems off, to quote her. And this is years ago, and I still remember to this day. And I remember sitting there in that chair, and like, a primary care PA student was the one that started this process. So you will see it, whether you like it or not. Yeah.
Why don't you tell us, like, what kind of things you see regularly when you work as an ophthalmology PA?
Yeah, so I'll talk about what my day-to-day looks like. Ophthalmology is obviously a specialty. Within ophthalmology, though, there's a lot of subspecialties. And so I do comprehensive ophthalmology, which is going to just be more like your bread and butter diagnoses. So in that, I'm going to see a lot of diabetic retinopathy, glaucoma, macular degeneration, cataracts, dry eye, chalazions, styes, pretty much, same day add-ons. And then I specialize in medical retina. So in the back of the eye is the retina, and you can do medical retina and also surgical retina, and I do both of those. So in that setting, I'm taking care of pretty much any eye condition that affects the retina, whether that's macular degeneration, diabetic retinopathy, but also vein occlusions, or even just genetic eye conditions that people are born with. And in this setting, I'm ordering a lot of imaging and doing the most common procedure I perform, which are intravitreal injections, where we inject medication in the eye. And then surgically, I help first assist in surgical retina, and that's doing epiretinal membranes, macular holes, retina detachments, people who had cataract surgery and their lens fell into the back of their eye, or some of the cataract fell back. There's so many other things that we do. And so it's hard to answer that succinctly because it's like, it depends which part of ophthalmology you're in. And then even that, I do oculoplastics, which is a field in ophthalmology that specializes in facial and reconstructive plastic surgery, but around the eyelids and like the orbit. And so in that sense, clinically, we do a lot of eyelid biopsies. I would say the most common is like basal cell carcinoma, and we reconstruct the eyelid after they've seen a Mohs surgeon. Or we'll do, people have the extra skin on their eyelids, dermatochalasis, or their eyelids droopy called ptosis, so we surgically correct that. So there's a lot of scope, and I love it because I get to do surgery in clinic, work with my hands, and I feel like I get a blend of even some other specialties. Like I'm constantly working with ear, nose, and throat, and neurologists, and other things that really blend over between ophthalmology and other specialties, rheumatologists, primary care. And so The eye, yes, we see ocular conditions, but we see a ton of internal conditions that manifest in the eye. And so I don't feel like I gave up my primary care training. You know, like how PAs talk about your primary care, and if you specialize, you're going to lose all of that. And I understand that it can be an element, but in this context, for me, ophthalmology, I honestly don't feel like I gave up a lot of it. I'm seeing so many internal conditions in the eye, so I still have to stay current on a lot of it, and I do to this day. The last thing I do in the clinic outside of those things is I do history physical clearance exams. Our patients require like a pre-op, and if you've ever done primary care, I used to do these in family medicine all the time. Our clinic finds it's easier, instead of coordinating with the PCP, they just see me. And as a P, I'm definitely trained to do EKG, ordered labs, bridge medications, and clear someone for surgery. And I love that because it keeps those primary care skills in addition to ophthalmology. So I have a great job.
Yeah, it sounds like it. Wow, it's really exciting. Of course, I cringed when you said earlier the needle in the eyeball.
Yeah.
I mean, how do you even do that for the first time? Does it not freak you out?
When I was a tech in ophthalmology before PA school, I assisted with thousands. We would do 80 a day. And so for me, by the time it became for me as the PA to be the one doing them, it was kind of like it wasn't see one, do one, teach one. It was I've seen thousands. I just need to go do it. Now, granted, doing it was a lot different than assisting. I know it seems kind of gross, but it's really not. It's not. And it's painless for the patient. There's multiple ways to anesthetize the eye prior to the intravitreal, the injection going into the eye. And it truly is a pain-free experience for patients. Yeah.
Just the thought of it, like you said, and I've worn contacts, so I put my fingers in my eyes, no big deal, but just the thought of a needle going in there, or
yeah. Well, it's better than going blind.
True.
And in the grand scheme of things, I remind patients of this a lot. Like in my lifetime, I have family members who went blind from conditions that we now can prevent blindness because of injections. Wow. It's actually relatively new technology, which I love being a part of in the current advancements in our field.
Are you pretty autonomous when you're working in the clinic? Are you seeing all patients, like new patients, follow-ups and stuff, or do they go through the ophthalmologist first and you're mainly doing follow-ups? How does that work?
Completely autonomous clinically, completely. And I mean, I have supervising physicians nearby. It's not like I'm by myself, but I have my own schedule. I've always had my own schedule from day one, and that's something I advocated for very clearly early on. I have a lot of shared patients, especially when it comes to some of the retina patients. Retina patients who get injections in the eye for, say, macular degeneration, diabetic retinopathy, macular edema, whatever, they often have to have ongoing treatment. And so you have a lot of continuity of care with patients. And so some of my patients are shared with the ophthalmologist, where they might see the ophthalmologist and then they might see me for the next 2 visits, and then I'll punt them back. That way, the ophthalmologist kind of has tabs on them. So it's a very autonomous schedule, but I'm working alongside shared patients and my own as well.
What about surgery? Are you like first assisting in ophthalmology surgeries? And if so, how does that happen in such a small space?
So there's a ton of eye surgery out there, and I'll answer this just in question regarding like the utilization of PAs in ophthalmology. So there's certain eye surgery that you really just don't need a PA for to assist with. Insurances to bill a PA first assist fee, there's only certain eye surgeries that will qualify for that first assist fee to be billed. Okay. So for example, LASIK or cataract surgery does not reimburse a PA to be there first assisting. So it's kind of like, what's your point? Right. Whereas vitreoretinal surgery, oculoplastics, it does. Vitreoretinal surgery, I'm assisting with, like I said, epiretinal membrane removers, macular hole repairs, retina detachments, scleral buckles. I'd say in vitreoretinal surgery, the scleral buckle is probably the highest one where I'm hands-on with the most. The second to that type of surgery would be what we called like either scleral fixation of an intraocular lens, whether that's through a technique called Yamani or suture. Those would probably be the highest yields. Oculoplastics is definitely more hands-on for me as a first assist. It depends a lot upon your attendee, but for example, if we're doing a blepharoplasty for patients with extra skin, upper, say, and lower, my attendee, I do one side, she's doing the other. So it's very full scope. Other surgeons may be a little more, let me do the removing and all that, but you can do the stitching and all that stuff. Right. But a lot of oculoplastic cases, we're doing more orbital work or something within the nasolacrimal duct. And so I'm definitely more, I would say what you envision a PA first assist, saying like a general surgery or like an ear, nose, and throat surgery or a plastics. It's more that type of assisting. Yeah.
When you're doing the other vitreal surgery, are you both looking through microscopes into the eye, or how does that work?
So yes, a lot of eye surgery is under a microscope. Besides oculoplastics, we don't use a microscope, but we do have our own magnifiers that we attach to our face to kind of have an up close view. But with vitreoretinal surgery, for example, it is through microscope. The surgeon has his own binoculars, I have mine, and you're working directly under a microscope into the back of the eye. And it's a very small space. And so you have to be interested in more delicate, intricate type of surgery, more microscopic, not macroscopic. And being that was my experience before PA school, any rotation like general surgery, I was like, I don't like this big surgery. I definitely prefer my personality and just kind of me. I prefer working more in small, delicate, intricate areas.
That probably leads pretty good into the question about what you love in general about ophthalmology.
To answer like what you love about it, it's helpful to understand like who would be a good match for it, because there's a lot of things that we love, but sometimes you go, actually, I'm not a good fit for this. And ophthalmology, I find I do better having a craft and kind of working on that craft and being a master of one thing versus like a jack of all trades. I also find my learning styles tend to be visual and kinesthetic. So that learning style, if that's you, you're going to find you'll thrive in this, because for me, like, because I'm a kinesthetic and visual, I can take a patient's complaint and I get to see it right then and there with my own eyes through a slit lamp. And so my learning styles really thrive, and I could start really building those brain processes to really understand what was going on, because I could have a visual of what a patient's symptom meant and what that looks like. And then it's just so hands-on. Our exam is very hands-on. We do so many procedures with our hands. We have so many, instruments that we do, and I love that. So if that's you, you might be a good fit for this. So the impact was like, in one day, I can either prevent blindness, give someone's vision back, or I can diagnose them with an internal condition and maybe save their life. And it's the rewarding aspect of that, and that you like can see the positive outcome of the work you put in. Honestly, too, like, ophthalmology patients are very compliant, partly because we use our eyes to do everything. And so patients are pretty compliant. They show up for their visits. They're consistent with treatment. And so I find you have really good relationships with patients. It's incredible.
So what about like your schedule? What are your hours like? How many days a week do you work? How many patients are you seeing a day?
I'm very lucky. It does not escape me for one moment how lucky I am to work 32 hours a week. I have Wednesdays off. I have weekends off. I don't take call. I have 2 days in clinic, 2 days in surgery. One thing I love about eye surgery is it's outpatient, it's ambulatory. So patients go home. They don't get admitted to the hospital, which means I go home. I don't have to wake up and round on my patients before I have a full day of clinic. I just see my patient in the clinic. And so I see clinically, it depends on the day. Ophthalmology is a very team-oriented field because we have technicians that do a lot of our intake. Then I don't have scribes, but you might probably have a scribe. I used to be a scribe. And so it depends on the environment that you're in. I've been in clinics where I was seeing 50 patients a day, but I had 3 technicians and 2 scribes, and the chart was closed by the time I walked out of the room. It was possible because it's a team. In the setting I'm in at now, I have less help and I don't have scribes, and so I see less. So I see about clinically like in 20 to 25 a day. Surgically, depends on the specialty, but probably around like 4 to 5 cases a day. I'm rarely, if ever, staying late to close charts. My day is like 8:30 to 5:30 is like what I'm there for, with an hour for lunch. And I would say the maximum I'm spending after those clinic hours that a lot of us in medicine find we're not getting paid for. I'm probably out the door no later than 5:45, maybe just tidying some things up. Most of my charts are closed before I leave the room, and that's even with me doing it, and I'm not having a scribe. And so it's a great field as far as even charting, to be honest.
But what about pay? Does it pay well?
If you're coming into ophthalmology with, say, no background in ophthalmology at all, you're going to start definitely on the lower end because of the long amount of training it takes to get you up to speed. So plan on taking a pretty big, significant pay cut compared to just your average PA, but negotiate the contract where eventually you could get up there to kind of the standard rate. If you're someone like me who has experience in ophthalmology, I find you're going to be paid a lot more than your average PA colleagues, given just your uniqueness and that they can't find people like you with your knowledge and background. And so you're going to be worth to them to be compensated a lot higher than the average PA because you're still cheaper than an ophthalmologist and they just can't find someone like you. And so you're going to get offers left and right once you get in the fields.
Are we talking like 150,000? Are we talking
Well,
higher?
like if we're talking like for the higher end,
Yeah.
say if you're an ophthalmology PA and you've been doing it for 3 years, you should definitely be way over 150. Within 5, you're going to be in the upper 100s. And then probably over 5 years, more in the 200,000 range.
So it sounds like that there's a lot of great things about ophthalmology, but every specialty has its downsides. What would you caution people to really think about?
The biggest one that stands out to me would be the training. It's extremely an undertaking to learn how to do ophthalmology to the point where you can see patients by yourself, have a pretty large scope, and be comfortable managing them and not be second guessing yourself. And so that would probably be the biggest negative is I think people, they hear me talk about it. This sounds cool. I want to do it. Let's try it. And then they're like, no, I don't want to do this because the overwhelming amount of onboarding it takes to get there. With that then comes a lot of conflict within the clinic, not relationship. They just don't know how to use you. So I would say those are probably the biggest barrier. And for people who aren't passionate about ophthalmology, then you're going to probably want to walk away because keep in mind, as I said earlier, you might be taking a pay cut to do this. Right. And it just becomes too much for them and it's not rooted in passion and it goes away. For me, I was willing to work through that because I could see the end to what this could be.
What are some of the barriers to getting into ophthalmology as a PA or an NP? Because NPs can work in ophthalmology too, correct?
Yeah.
So what are the barriers beyond the fact that it's just not, well known? Are like laws? Are there different laws that make some things a challenge?
The barriers are, again, it's not common just for PAs, but even like ophthalmologists aren't aware PAs are an option. So they're not looking to hire you. You have to go look for them. So be ready to pave your own way. Secondly, the common one that you'll hear is there already is a provider that's assisting the ophthalmologist being an optometrist. And so why hire a PA when you have an optometrist who went to 4 years of optometry school? They have way more knowledge and training going into work than a PA would. So why pick them? And that kind of goes to some of the laws. And so it depends on the state that you're in. But in ophthalmology, it's not just whatever you and your supervising physician want to do. There are limitations mostly around optical. And in my state of California, I am not allowed to perform any sort of refractive nature of the eye. I can't prescribe glasses. I can't prescribe contact lenses. When I was a technician, I did better one, better two all day, but now as a PA, I can't. And that is some limitations, I guess, in that sense when it comes to the laws and why people may be, I won't use a PA because they can't do certain things within the field. Yeah. So it really then goes back to figure out, what type of environment do you want to work in an eye clinic? And for me, I do full-blown medical and surgical ophthalmology, which is what I wanted to do, which is why I didn't pick optometry school. That's not saying they don't do those things. Optometrists do so much medical ophthalmology and they're definitely trained for that. But you don't see an optometrist doing surgery, and I knew I wanted a surgical aspect. And I also, you do see optometry managing more the optical things than an ophthalmologist, and I wasn't interested in that either. So although it's a limitation a lot, it doesn't really bother me because I don't have interest in doing it. Pretty much any state, an NP or PA can work in ophthalmology, as long as it's more your medical surgical. There are states that do let a PA or an NP do the optical side of ophthalmology. I have some PA ophthalmology colleagues that have a full-blown optical scope to their practice. So it is an option for any state, but you just might have some areas where you're not allowed to do.
So for people who might be interested in ophthalmology, as a PA or an NP, are there any kind of associations that they can join or belong to?
So the answer to that, and I'm proud to say, is now there is, yes. When I first started ophthalmology, I was very alone on an island. There's no PA colleagues to work with. And I think what you're asking is, are there resources out there for PAs? We actually have just formally created within AAPA, they have specialty organizations, they call them. There's some for dermatology, all these things, and there's none for ophthalmology, but we just got approved. We're the first ever ophthalmology physician assistant group within AAPA, and we will serve as the mediator between AAPA and the American Academy of Ophthalmology, AAO. And so now there is, and it's going to be a resource that's going to be out there for people to become members of. And then I also just kind of started doing that on my own because I started meeting other people like me who worked in ophthalmology, wanted to do this, didn't think it was possible. There's a lot of you out there actually. And so I actually created my own consulting business where I teach either pre-PAs or PA students or practices or current PAs how to become an ophthalmology PA, just because once I realized I could do this and was doing it, then I just started seeing so many people wanted to do it too. And I wanted them to have that resource that I really didn't have, and kind of
Right.
learn from a lot of my trial and error.
Yeah. So what is your consulting business called?
The acronym's OPAC, Ophthalmology Physician Assistant Consulting. So OPAC, OPAC, kind of PAC, you know what I mean? And then you can find me at my website, just www.joelsilek.com. But yeah, happy to help, honestly. Feel free to check out the website, but it really is catered into trying to teach you all how to do this successfully, whether you're a practice or you're a PA student. I can teach you how to effectively onboard a lot more efficiently, where you actually are enjoying that process. And then to connect you to both parties who are looking either for a PA to do a job or a PA that's looking for an employer. And so I currently have 6 practices that are wanting an ophthalmology PA, and they're looking for someone. And so I just basically saw there was other people that wanted to do what I did, and I wanted to help people do that and show them this is possible.
Such good stuff, Joel. Thank you so much for telling us about that this is an actual opportunity for PAs and NPs, and for also being willing to help people find their way.
Yeah, absolutely. I think that's what life's about. So happy to help with that.
That is so cool. I had no idea that PAs and NPs are working in ophthalmology, especially to that extent. It does seem like a really great opportunity, but like Joel said, you really have to have that passion for ophthalmology to be able to find those opportunities to push through that learning curve and to really enjoy what you do on a daily basis. So this is just encouragement for people out there who are interested in ophthalmology, but who didn't think it was a possibility in the PA or NP world. It definitely is. There are resources there to help you, and I encourage you just to really go for it. If you want to find out about PAs and NPs doing other things, working in different specialties, cool and unusual jobs, you can check out these videos here, and you can go to the playlist on my main channel page. Thanks for joining me. As always, take care, stay sane, and I'll see you next time on the Medicine Couch. Bye.